Hi, my name is Abby Ferdinand, and I am a clinical oncology pharmacist from the Monument Health Cancer Care Institute. And along with my co-investigator and co-worker, Jan Lowe, who is also an oncology pharmacist, we are presenting our research findings for the Quality Showcase submission, Preventing Febrile Neutropenia in Breast Cancer Patients. Timing is everything. Cytotoxic chemotherapy can severely suppress the bone marrow and eradicate production of infection-fighting neutrophils. When the neutrophils fall below a certain threshold and patients become febrile, this is considered to be febrile neutropenia. This is an oncologic emergency and is a potentially fatal adverse effect of chemotherapy. Patients with febrile neutropenia require urgent clinical assessment, stat administration of antibiotics, and often require hospitalization for further care. Pegfilgrastim is a granulocyte colony stimulating factor that is used to promote neutrophil production, maturation, and activation. It is routinely administered after chemotherapy to prevent febrile neutropenia and is administered by subcutaneous injection at the oncology clinic. Breast cancer patients receiving dose-dense doxorubicin and cyclophosphamide chemotherapy experience febrile neutropenia at a rate of more than 20%, and pegfilgrastim is indicated to be administered after chemotherapy to prevent febrile neutropenia. The optimal timing of pegfilgrastim administration has been debated within the literature. Multiple studies have yielded conflicting clinical outcomes when evaluating same-day versus next-day administration. Same-day administration is when patients receive their chemotherapy, and at the end of their infusions, when the chemotherapy is all infused, they then receive their pegfilgrastim injection on the same day. Next-day administration occurs when patients return to clinic 24 hours or the next day after their chemotherapy was infused. Some of the pros for same-day administration include improving patient satisfaction through convenience of not having to return to the clinic for a next-day injection. This approach may also increase the utilization of cost-effective biosimilars. Next-day pegfilgrastim administration is preferred by NCCN guidelines. However, given the lack of solid data, some institutions have adopted same-day administration for the reasons noted above. To date, there are no studies comparing febrile neutropenia rates in breast cancer patients receiving dose-dense AC and pegfilgrastim same day versus next day. At Monument Health, our current practice is to administer pegfilgrastim next day for all patients who require GCSF support. The goal of this research is to compare the incidence of febrile neutropenia associated with same-day versus next-day administration of pegfilgrastim in breast cancer patients receiving dose-dense AC. Secondary objectives include the rates of hospitalizations, acute care visits attributed to neutropenic complications, chemotherapy dose reductions and cycle delays, antibiotic use directly associated with chemotherapy-induced neutropenia, and documented grade 3 or 4 neutropenia. The official title of the pharmacy research protocol is Efficacy of Same-Day versus Next-Day Administration of Pegfilgrastim and its Biosimilar for the Prevention of Chemotherapy-Induced Febrile Neutropenia, a multi-site analysis. This research protocol was approved by ethical and institutional review boards at each participating center. This is a retrospective multi-center cohort study that included breast cancer patients of any stage, age 18 years or older, who received dose-dense AC and pegfilgrastim between June 1, 2016 and May 31, 2020. Chart review was completed at 3 separate cancer centers. These included Monument Health Cancer Care Institute, Avera Cancer Institute, and Mercy One North Iowa Cancer Center. All patients received the total 4 planned cycles of chemotherapy, and pegfilgrastim was given on the same day as chemotherapy at one site and next day at the other 2 sites. 440 total charts were reviewed. After excluding patients based on various exclusion criteria, there were 146 patients included at the same day site. For the next day site 1, which was Monument Health, there were 133 patients included, and at next day site 2, 81 patients included. Below are the results for our primary objective and our secondary objectives. For febrile neutropenia for all cycles, at the same day site, the rate was 24.7%, as compared to 11.7% at next day sites. This led to a statistically significant difference of 13% with a p-value of 0.002. Administering pegfilgrastim on the same day as chemotherapy led to a significant increase in patients developing febrile neutropenia compared to the next day administration approach. The results of this study further support prescribing information for administering pegfilgrastim the day after chemotherapy when used with dose-dense AC in breast cancer patients. This research ensures our breast cancer patients at Monument Health and other health systems are receiving pegfilgrastim at the most appropriate time in relation to their chemotherapy. This research was published in the Journal of Oncology Pharmacy Practice and demonstrated evidence-based results that directly impact breast cancer patients everywhere. Decreasing the likelihood of febrile neutropenia is imperative. It decreases chemotherapy dose reductions, decreases excessive healthcare utilization and resources, and improves outcomes and decreases complications. Further studies are needed in different tumor types and chemotherapy regimens to determine if same-day versus next-day administration has similar or differing outcomes as this study. Listed below is an abbreviated reference list. Thank you so much for listening to our presentation, and as always, please let us know if you have questions. Thank you.